Good afternoon. We're here with Deputy Humboldt County Health Officer Dr. Josh Ennis for the June 25th media availability. Thank you for being here with us.
Yeah, thank you.
As far as the county's pace of reopening, how closely are we following the guidance of the state? And what would it take for Humboldt to deviate from that guidance, whether it be opening more quickly or backtracking, putting the brakes on things? How do yesterday's 9 cases play into that?
Well, I would say that as far as following the guidance goes, we have always been aligned with the state's guidance. As the state has provided guidance for those items, they have basically laid out how they would like to see it done, and then we at the local level have determined when that occurs. And so we have always been aligned with what the state is saying in terms of following the guidance. In reference to the 9 cases that were reported out yesterday, that clearly would raise some concern about more disease transmission locally. And so, from the very beginning, we've tried to frame this and talk about expanding and contracting the response, that we could move forward. And if things potentially do get really bad, we could potentially have to move backward. And so it's a very fluid and dynamic thing, and we are currently building out a framework that will allow us to have kind of a guide to pay attention to some of those things. And 9 new cases in one day, and there are different ways of looking at it statistically, but we're trying to look at certain trigger points of when we would move through different phases of a continuum of a response. And so we're hoping to release that alert level system, which looks specifically at some of these things in the near future.
Thank you. Can you share the general areas of yesterday's reported 9 positive COVID-19 cases in Humboldt? There are rumors circulating in Southern Humboldt that these were from community transmission at a cannabis farm hiring out-of-area workers. Can you share more information?
So when new cases, by virtue of where they work or what kind of interactions they have with the general public or where they have physically been, in cases where we think it represents a threat to the general public, we will release that information. At this time, we're currently undergoing investigations to determine if that has occurred or not, and if we feel it's important to let the public know, we will do so.
Before yesterday's 9 reported cases, public health expressed some concern over travel. If we continue to see a spike in cases, what is the possibility of reinstating a 14-day quarantine for visitors and residents coming back into the county or other travel restrictions?
Yeah, I think this question is coming from previously there being a recommendation from public health for anyone traveling out of the county to self-quarantine upon re-entry into the county. What became clear to us was that it was getting more and more difficult to determine how much risk was associated with a particular destination, and it seemed that disease was spreading pretty much everywhere, domestically and internationally. And so we felt that people were moving in and out of the county, and so in this harm reduction sense, we were acknowledging that it's going to occur anyways. And so we were trying to look harder at really honing in on how much risk is involved with what activities are done when someone travels outside of the county. And so we felt that we needed to make a move towards putting the focus on activities that place you at high risk. And those are activities where if you're not social distancing, if you're not masking, if you're not practicing good hygiene with frequent hand washing, that's going to put you at higher risk for contracting disease, more so than just leaving the county per se. So I think I see it difficult to reinstate a quarantine on anyone who leaves the county because so many people do it via air, via ground, and it's extremely difficult to enforce that. I won't say that there's no possibility at all, but we've generally acknowledged that it's going to occur anyways, and so we're trying to put the focus on the activities that place you at increased risk rather than travel per se. But one thing is for sure, We, at the beginning of this, had very little local disease, and we continue to see more and more cases that, in many cases, are related to travel out of the county, and so it's still being imported.
And what is the current advisement about traveling domestically or internationally when you come back?
Yeah, so currently, if someone travels domestically, we don't put a necessary quarantine on those people. We're not recommending it. When someone comes back, we recommend that they self-monitor for symptoms, but do not need to quarantine and stay at home. The second that they develop symptoms, we ask that they isolate at home and they pursue getting tested, and anyone else who is in the household, that they also observe those same precautions. Now, if someone travels internationally, we are still recommending that they quarantine at home. And when I say quarantine and isolate, that really means you stay at home and the only reason you leave is to go seek medical care.
Okay, thank you. You said previously that expanding emergency healthcare workforce capacity might be the most critical component of meeting a surge of cases locally. Can you please provide an update on efforts to develop such a workforce and where it might come from should Humboldt County's healthcare system begin to be pushed for capacity?
Sure. In the setting of spreading disease, we know that more healthcare workers will become sick, and that'll thereby make the workforce even smaller. And so I think we recognized this early on, that this is probably going to be the true bottleneck in having surge capacity. So, at the extreme end, we can look at things with getting creative with who delivers the care and at what ratios. We hope to not get that far. In that kind of middle ground, what we're doing is bringing a lot of different healthcare leaders together across the county, and we're talking about ways to allow that person to potentially step into another role in another setting, and almost in a way sharing the healthcare workforce across those different settings if it came to a point where we needed that. And so we've been actively trying to develop the ability to do that, getting the right people across different institutions to talk about what this would actually look like and develop that pipeline to serve for people who wouldn't normally work in that setting and take care of the sick.
Can you discuss how one super spreader event has the capability to fundamentally change community case trajectories in Humboldt County?
Sure, yeah, a super spreader event, I think we've witnessed this in many different settings across the U.S., internationally, and it's very apparent that a single person in a higher risk setting can spread it to 50, 60 people. And the one thing that remains fairly consistent through these is that they tend to happen indoors where there are a lot of people, and when those people are together, it can even be for a short period of time. It can be as short as an hour or two, and the fallout from that is upwards of half or even 2/3 of the people in some of these settings come down ill. So you could imagine if you get 100 people all in a big room together, no one's masked, there isn't good air exchange, and they're in there for 2 hours, and while they're not masked, they're doing forceful exhalation, things like singing, for example. We know that it's very possible for upwards of half of the people who participate in that to become infected. And so to bring that home to Humboldt County, I think Humboldt County is very early in this still. This is far from over. We've previously said that we have some antibody data, which suggests that somewhere around 1.5% of our population has been exposed. So for the vast majority, the other 98.5% in our county has not been exposed yet, so they are still susceptible to infection. And so when you bring all these people together, potentially, I'd say almost everyone in that building is likely susceptible to infection. And because we're so early in this could be the start of a wildfire. Investigating that one person and then tracking down all 100 other people who are in that building, for just to continue with the same example, it is laborious, it's cumbersome, it takes time. It might take us 2 weeks to get all the names of everyone who is in that facility, at which point they've already become symptomatic, they've already been doing the same things they've been doing for a week, and perhaps they went to another event a week later with another 100 people. And you can see how this quickly stacks up, and this is where, when we talk about exponential growth, why we worry so much about stuff like big events like this and a super spreader event. And with us being so early, it could throw us right onto a exponentially accelerated growth curve.
Having access to quick test results will play an important role in resuming sporting events, keeping businesses and factories open, and returning to school in the fall. But sometimes tests still take days for the results to be returned, despite an increase in the availability of testing across the country. What is the average turnaround for test results in Humboldt County?
So having quick test results is important not only for the events and activities that is laid out in the lead into this question, but it's important for case investigation. It's important for timely contact tracing. It completely impacts the decisions you make, and so having quick test results is paramount for all situations. And this has been something that we have experienced some frustration with having longer turnaround times. It sets you back. The average turnaround time for tests in Humboldt County really depends upon what route is being pursued for testing. Our lab here within public health remains probably the fastest turnaround time available in the county, and we can turn around typically in 24 to 48 hours, sometimes as long as 72 hours. But we have limited capacity on a daily basis, so we can't run a high volume. There are other routes. Many of the hospitals have point of care tests which are available. They're not quite as accurate, but that is one possibility. One of our local hospitals here has a high throughput PCR machine, so it performs very accurately, has a fairly quick turnaround time on the order of a few hours. And so that is a potential possibility for a quicker turnaround. Now, I think what this question is trying to get at is that some people have had some frustration with the OptumServe site, and they do give us a weekly report out on how long those tests take. And as of 3 weeks ago, 2 or 3 weeks ago, they were reporting a turnaround time on average of 73 hours. So that's 3 days on average. There will be outliers on either end of that, obviously, but that is something we pay close attention to because it has huge impact for delaying return to activities as laid out in this question, as well as case investigation and contact tracing.
Thank you. A lot of times when we cover breaking news in the field, viewers will comment on the live feed asking why first responders are not all wearing masks. This reporter is asking, do firefighters and police need to wear masks on service calls? And is there any situation you can think of where it would be permissible for them not to do so?
Yeah, so I'll remind you that there is a local county order for facial coverings. There is also a state order for facial coverings. So there are exceptions in which someone does not have to have a facial covering, and that's if it interferes with any medical condition, or it's just dangerous to do so, such as for children under the age of 2, and locally it's recommended for 2 to 12, but not actually mandated. Mind you, on the local order as well, if you can maintain 6 feet of distance and you're outdoors, you don't necessarily need to have a facial covering either. So there are instances in which someone does not have to always have a mask on. There are instances in which it may be dangerous for someone to be wearing a mask, even in those scenarios where they're within 6 feet. So our expectation is that people abide by the local and state orders.
Can you please describe long-term practices public health would recommend for keeping immunity strong and recovering from illness?
Sure, these are just general things that we should be striving for at all times in our life, and that's to eat a good diet, to get plenty of rest, to get plenty of sleep, get outside, And, you know, in the context of COVID-19, as we're starting to see cases tick up, we are getting closer to the fall and winter, and that is flu season. And so, looking ahead, you know, people may want to reconsider whether it's worthwhile getting an influenza vaccine or not. This can potentially help contribute to ensuring people don't get as sick and don't end up in the hospital, or altogether do not develop disease due to the flu at a time when we may be seeing more COVID-19 circulate in the community.
Excellent, thank you so much.
Yeah, thank you.